Enhanced Care Management, also known as ECM, is primarily a state model that was established in 2022. And it basically was a model that was formulated to help patients with complex needs to ensure that there are no gaps in care.
Community health workers are the first point of contact for the patient, and what we do is we conduct outreach calls as the first attempt of contact. Usually, if patients are referred to the ECM program, they're high risk, so they can be homeless, or they've been in and out of the hospital or ER visits in the past 6 months or so. Sometimes they're in nursing homes, and so their insurance thinks that they would benefit from having more care coordination.
Basically, when I have a patient, I first do a soft introduction of myself as their new case manager with them. Try to assess their needs, and if need be, I do the care plan with them as well, and try to find out who their provider is so I can provide better access. Once we get to that point of figuring out what their needs are, we try to access the resources, county resources, resources online, whatever we can find with them. We do have patients with different populations of focus. We have some that are veterans, some that are homeless, some that are children, disabilities. So we definitely just try to connect with them.
Basically what I do is that I support my own caseload and clients, but also support everyone else's. What I'm doing right now is doing a chart review, which is basically I go through all our enrolled members, read through their charts, look at their care plans, and making sure we're meeting the goals that we set for them, and just providing some advice along the way as I'm looking at their hospital visits and what chronic problems they're coming in for. I also help support with care plans. For example, if they give me a care plans with certain goals, I just make sure they meet our SMART goals, meaning that they're very specific, measurable, achievable, all those things, just tweaking them for each of the members. For my own members, we connect them with resources that they need and just tackle the barriers they have. A lot of people who I talk to, at least personally, they're not aware of the resources around them. Because if you go online and the websites, there's a lot of information and it's hard for people to navigate. So we're just here, just try to break it down. We kind of like to say we hold our hands, because ultimately at the end of the goal, we want them to be more independent and aware of the resources, but we're just here to hold their hands and just guide them through the process, because it's very confusing for a lot of people. I know in my own personal experience with my parents, they are immigrants, so they were aware of the resources available to them. So just being there and just guiding them and just breaking things down in more simple terms and would just help them get the resources that they need.